In this scan, liver is normal. The right kidney shows mild hydronephrosis and a calculus seen in midpole. This is a longitudinal scan of the kidney, but the stone is not properly visualized in this view. Now with transverse view, visualize the pelvis of the kidney, and a full stone of size 22 mm is seen in the pelvis. For renal scan, always visualize the kidney in longitudinal and transverse view, in lateral and spine position of the patient. Stone in the pelvis can be missed if you only see in one position or in one view of the kidney. This is a large stone and requires surgically treatment from urologist. Ureter is not dilated. Urinary bladder and left kidney is normal.